got a consent form here. Perhaps you ought to sign it before I change my mind.
What's a visitor for you?
Your potassium levels are still very high. Suggesting dialysis wasn't completely successful, so we've given you a couple of units to help with the anemia.
Well, I heard you had a rough morning. You okay?
I'm fine.
Just had a call from the transplant unit. In view of Pete's deterioration and his exceptional circumstances, they've decided to accept him for a cadaveric organ. They're cross-matching a kidney right now. Just had the call.
That's fantastic.
We'll leave you to it.
You are unbelievable. You're building up their hopes on nothing but theory.
It's better than no hope at all, isn't it?
What about the risks?
There's risks. There's risks in every aspect of this job. You better bear that in mind if you're thinking about becoming a doctor.
This is amazing. I can't get my head around it. Yes, it's great for Pete, and it's good for you both. I can't describe it. I felt like I'd let him down. He said I was his only chance. When all this is over, when Pete's well again, you and me are taking a long holiday.
Right. What do you think of that?
You look like Russell Grant. Good job you're a nurse, not a stylist.
Oh, I tell you, she doesn't stop, does she?
Thank you, Margaret. Her ECG is showing low voltage, maybe some build-up of fluid. You keep a close eye on her. 15 minutes ops.
Yeah, of course. Oh, before I forget, your wife called. She said they're keeping her in for more tests.
Tests? What sort of tests? I better go down.
No. She said she'd react like this. Nothing to worry about. She'll be up to see you as soon as they've let her go.
Okay, thank you.
Can I call you right back?
Are you really doing this for Pete, or do you just want to be the first man on the moon?
I don't deny that deep down my pioneering side is playing its part, but I swear I would never have made this decision if it wasn't the right thing for Pete. He's 30 years old, for God's sake.
Well, I need to know for sure that you're doing this for him.
Of course I'm doing it for Pete. And for all the other Petes that come after. I mean, think how many other lives this could save.
Okay, what if anybody on the surgical team realises that it's a pig's kidney?
Ah, well, you see, they're almost identical in shape and colour. A little bit more scallop than ours, but apart from that...
And how do you explain the mystery human donor?
I'm going to say there's a cadaveric organ coming in from Bath General for another patient, and I shall simply put the made-up cadaver's details down as the source on Pete's file.
No, that could still cause problems. I've been thinking about this. What if any of the staff recognise Pete's name? You could make a fake patient's detail. You could print out new labels, put them on Pete's form, fake cadaver's details, everything.
Sorry. The board are asking for the latest surgical audit figures. Everything going all right?
Yeah. Don't know how I could have managed without her.
Good. I'll leave you to it.
Saw you talking to Kim earlier.
She doesn't know anything.
You seem very happy together.
Yes, I don't think I've ever felt like this about anyone before, and I don't want to lie to her.
It doesn't really matter how close you are. We've got to keep this between us.
What do you need me to do?
So where's your sister?
Caribbean.
Oh, very nice. Always fancied a trip round the islands for my honeymoon.
Pretty girl like you, not married. Thought you'd have landed yourself a nice rich doctor.
I don't do doctors anymore.
We don't need it too long. You don't want to end up an old spinster like me. What's happening?
It's all right, Margaret. Let's put this on. Go and find Mr. Hope for you.
You're a slave driver. Take a rest for a few minutes if you like. Mr. Milliner makes me do this every couple of months, so I know what it's like. What is it you have? You're the doctor. You tell me.
At a guess, cerebral palsy. Sorry, it's the inquisitive GP in me.
Yeah, it's fine. Most people are too scared to ask me about it.
So?
How do I cope? I manage. Get a little help around the flat when I need it, but I try and do most things myself. Mr. Milliner's got me involved with a self-help group for people with disabilities. Thinks I'll make a good role model for them.
You don't sound too happy about it.
Some of the people, they do my head in. You want a tissue?
Please.
All they want is for someone to fetch and carry for them. Giving up on trying to live any kind of normal life. The physios are too soft with them. I tell them exactly what I think.
Here's me complaining about doing this. I've had all these years of a healthy life.
How are you finding the test, Gina?
Not as easy as before.
Well, as you can see, there's been some deterioration in your motor function. Your full vital capacity is about 60%. I don't have to spell it out for you.
My diaphragm's weakening.
I'm really not sure that you should be thinking about making such a long trip.
How long has she been like this?
A couple of minutes. She went downhill very quickly.
Okay. Fluids, she'll need some fluids.
Do that for me,
Let's
please.
get an echo done. Tamponade, aspiration kit, cardiac monitor, please.
What's wrong with me?
You have fluid building up within the pericardium. That's the membrane surrounding the heart, probably caused by the valve replacement.
So it's not the motor neurons.
I don't think so. I'm going to need to drain off the fluid. Can we do this quickly, please? Sharp scratch.
What's causing that?
The lining of a heart was exposed to her blood during the aortic valve replacement. I can only assume she's had some kind of allergic reaction. Can we get a chest drain, please? Thank you, nurse. You should be able to breathe a little more easily now.
I'm still here then.
You don't get away from me that easily. We're going to need to keep you in for a few more tests until we find out for sure what's causing this.
Oh, I had plans for the weekend. Spot of hiking, get the mountain bike out.
Doesn't all this ever get you down?
All the time. But if I ever really sat down and thought about it... Don't get me wrong, I'm prepared for it when the time comes, but until then, what's the point feeling blue?
I'm asking you as one doctor to another. I want your professional opinion.
This is a very sensitive area in the neurological community.
Ever since I mentioned it, you've been out of sorts. Now, how bad can it be?
Research into the use of stem cells has come a long way already. It's a fantastic step forward for medicine. Nothing short of miraculous, if you believe some of the claims, especially for people in the latter stages of MND.
So why are you so against the idea of going to Singapore?
The simple fact is, Gina, even though the theory of stem cell replacement is sound, actually putting it into practice is somewhat more difficult. Look, I'm sure given time.
How much time?
They've started clinical trials all over Europe, but I think in reality we're looking at 10 years or more.
What about Margaret? She says she's come back a different woman. Surely you can see an improvement in her.
I can't discuss other patients, you know that, but what I will tell you, Gina, is that there is no factual evidence that this procedure works. They are firing in the dark out there. Every case is just an experiment for them.
All successful medicine has to start somewhere.
My concern is that if you make this long trip in the condition you're in, more than likely it will be detrimental to you. Look, I'm telling you this, not just as your doctor, but as a concerned friend. I don't think you should go.
No problem with Margaret Ryan?
Who's pericardiotomy syndrome?
Oh, another infection?
No. I don't think so. Apart from little blood, the fluid was clear.
The aortic valve replacement was always a risky procedure for someone in this condition.
Here we go. The decision to proceed was made purely on the grounds of quality of life. Please don't say I told you so now.
Bit harsh, don't you think? Considering I backed your decision despite my own reservation.
Sorry. I'm sorry.
I meant what I said before about taking time off. And what's her prognosis?
I'm worried that if the build-up of fluid continues, that Margaret may arrest. We need to find out what's causing it.
Do you think she's up to surgery?
It's not really a question of whether she's up
Need
to...
Mr. Milliner. Get his opinion. She needs to go under. I'll assist.
Connie, I can handle it.
There you go.
Is the amended file?
Something the matter?
Yes.
Kim's asking about the donor's family. She wants to send them some flowers or something.
No, we can't have her talking to the transplant coordinator. Just tell her it's an anonymous donor, yeah? A card carrier.
She'll be fine about this. Really.
The more people who know about this, the more at risk of being found out. We're just going to have to keep her in the dark on this. Now, cleared slots booked. Your anaesthetist should be down any second to check you out, sort out your pre-med. From now on, you're John Brown. So be careful what you say to him.
Look, if anything happens to me, I don't want either of you to take any blame for this. This is my decision.
Next time we see you, we'll be in theatre. Let's just step into the staff room. Right, let's say the courier's downstairs now with the cadaveric kidney. You go down to decipher it, but instead you nip off to the animal lab and pick up the pig organ. I've already told them you're on your way. Then you bring it up to theatre and hand it over in the normal way. I can't do it. I mean, it's not the correct procedure for a consultant.
So you couldn't have done this alone?
No. I thought if I carried on regardless, she'd eventually come round to my way of thinking. Well done on remembering the wristband, by the way. Mr. Griffin will be very pleased with your efficiency. I've prepared this letter for you. Don't open it. It's date marked and sealed. It says I take full responsibility, full accountability for whatever happens. I mean, Pete's hardly in a position to vouch for you should anything go wrong, is he?
How do I know there's anything in it?
You don't. I hadn't thought about that. You have my word for what it's worth.
Well, then, that's enough. We're in this together. I'm just as accountable as you.
I gather you've got one more for your list. Is it John Brown?
Yes, renal transplant. You know what it's like when the organ comes in, bit of a rush job.
Do you need me in theatre?
Oh, that's very kind of you, but, I think we'll manage.
Just asking you to keep an open mind.
I'm not going to lie to you, Elliot. I think going to Singapore is a bad idea.
In your opinion?
Look, I'm telling this off the record, okay? Whatever Margaret's told you about her treatment, I've seen no significant improvement in her condition. Look, she'll tell you she doesn't agree with my findings. Seems to take some peace of mind that there's a miracle cure out there. As far as I'm concerned, it's all in her head.
Well, I have seen a difference. She's even stood up for me.
I know you and Margaret formed quite a close bond. That's why I wanted to talk to you about it. I can show you her test results if you don't believe me.
Have you mentioned this to Gina?
I haven't mentioned Margaret, no. But I have given her my thoughts on the procedure.
Look, Elliot, I'm afraid there's been a marked decline in Gina's condition. You're going to have to see Sense Elliot. It's a waste of time and money.
Right. BP's 100 over 70, pulse is around 110. She's very breathless.
So what's exactly wrong with her?
The scan is showing a steady build-up of fluid around the heart.
Any idea what's causing it?
We think it's blood clotting in the pericardium from the valve replacement. She'll definitely need surgery.
Well, I don't think she could survive another anaesthetic. Can't you treat her medically?
We could do if there were time. We could try anticoagulants to reduce the clotting, but I'm afraid she may go into supraventricular tachycardia and arrest before they had any effect.
Looks like you haven't got a choice then.
Right. I'll get her prepped for theatre.
I'll need to discuss her DNR request. We talked about non-resuscitation before Margaret went to Singapore. She wouldn't entertain the thought of it. She was convinced she'd come back cured. Then out of the blue, she comes to see me after the heart valve replacement and requested it.
And what changed her mind?
She just said she was ready should anything else go wrong. I think deep down she realizes nothing happened for her out there.
Rebecca is driving me up the wall. 3 p.m. by now. Where's Mum?
She's still up in neurology, so they're doing some more tests. Look, I'm a little busy here. Why don't you go and see how she's doing?
Actually, I've got a bit of a surprise for you both. Becca has agreed to ditch the white wedding so we can get married in Singapore. That way you and Mum can both be there now. Mum gets her treatment, you get to be my best man. What do you think of that?
Sounds like a great idea.
He told me not to say anything, but I couldn't keep something like this from you.
But it's experimental.
He knows what he's doing. It's going to work.
So why be so secretive about it?
Because the hospital wouldn't allow it to happen if they found out about it. Look, there are legal implications.
Well, there must be reasons for that. It can't be safe.
Mr. Golding? Miss Felix? Everything all right?
Yeah, we're fine.
Look, I understand that this whole transplant business must be hard to swallow. But I assure you we are doing everything we can to improve your dialysis. Then it's just a matter of time.
Thank you, Doctor. I know you and Mr. Durand are doing your best.